how a patient's heart attack and stroke were misdiagnosed in the emergency room. Hello, I'm Marcus Boston, and I'm a medical malpractice attorney practicing law in the state of Maryland. And I would like to talk with you today about how a patient's heart attack and stroke were misdiagnosed in the emergency room. Now, how all of this started is that the patient showed up to the emergency room and told the triage nurse that he was suffering from shortness of breath, had chest pain, was having pain running from his abdominal area all the way up into his chest. And the triage nurse pretty much asked him, well, on a scale of 1 to 10, what would you rate this pain? And the patient said, I'd give it a 10. I've never felt pain like this ever in my life. Even with all of this said, the triage nurse determined that the patient was okay and that he was not suffering from anything life-threatening. There was also a note in this particular case that the patient had a very high blood pressure during this triage. So while the patient is in the waiting room, pretty much waiting for a doctor to come see him, an hour passes. And then a doctor finally does come and see the patient. And the doctor does begin to do a basic workup on the patient, but nothing at that particular time was being done in an emergency situation. Even though when the doctor saw the patient, the blood pressure was even higher. So from the time that the patient showed up to the emergency room till about 3 hours later, the patient then eventually suffered a heart attack while in the emergency room. And when the doctors went in to try to help with the heart attack, that's where they learned that not only had the patient suffered a heart attack, but the patient was also dealing with stroke. So why have I taken the time today to talk with you about this? Because I realize that if you're watching this video right now, you probably have questions. You're probably wondering, was your stroke or was your heart attack misdiagnosed in the emergency room? You're probably wondering, should the triage nurse have saw the signs that were present that should have alerted her that you were suffering from a heart attack or a stroke? Well, if you have these questions and concerns and your matter happened here in Maryland, this is what I invite you to do. Go ahead and pick up the phone and give me a call. I can be reached at 301-850-4832. Or if you prefer, you can send me an email to medicalinjury@bostonlawllc.com. We answer questions like yours all the time, and I will be glad to listen to your story. Well, guys, that's it for today's short educational video. Again, I'm Marcus Boston, and I'm one of the medical malpractice attorneys here at Boston Law Group, LLC. And we'll see you next time. Guys, take care and enjoy the rest of your day.